is Dr. Martin Luther King Day, a day of service. Welcome to the Power of One. Today it is my honor to speak with two healthcare professionals, Oscar and Jacqueline, who are registered nurses at Temple University Hospital, and they have employed methods of Dr. Martin Luther King in their daily lives at work. The great Dr. Martin Luther King said, "The ultimate measure of a man is not measured when he stands in moments of convenience and comfort, but when he stands at times of challenge and controversy." Dr. King also said, "The time is always right to do what is right." The first case of COVID-19 was confirmed in Philadelphia on March 10, 2020. According to the Philadelphia Department of Public Health, there has been over 103,000 confirmed infections and over 2,000 confirmed deaths from COVID-19 in our city. COVID-19 has changed so many things for us and have robbed family members of being by their loved one's side when they were transitioning or recovering. The power of a mother's hug, a father's touch, a husband or a wife's kiss, and it even robbed a child's ability to hold their parents' hand along the way of their healing process. Oscar and Jacqueline will walk us through the last 11 months of their life. Welcome to the show. Oscar, you work in the emergency room at Temple University Hospital. Please tell me how it was in the beginning of March when COVID first hit Philadelphia.
Good morning, Melanie. Thank you for having us and me on your program today. I think back to the early days of COVID when we didn't really know how or why it had came to us and it was transmitted. I think that as an emergency room nurse, I'm used to taking care of patients who come through the door not knowing what's coming through that door. This was a completely different kind of process, for lack of a better word. When we first came in, we did not know what we were dealing with, whether it was airborne, whether it was a contact. So we just accepted that people were sick. As they came in sicker, we then realized and we changed how we were doing it. We took our cue from what was happening in New York. We limited our visitors. We limited the access to the hospital. So that was very different. I think that over the last 15 or 20 years in medicine, we had looked at having patients' families having more access to them. Now we did a complete 180 and we denied them access to their patient, to their family members.
Now, Jacqueline, you were in the trauma unit. And
Yes.
again, we're just speaking about March, in the beginning when COVID first hit. How was it for you in March?
Well, in March, I was, at first, it was just like he was saying, it was very confusing. It was like one day we were wearing masks, the patients would come up, and we just didn't realize what it was going to be like. We figured we could handle it. But when the patients started coming in overwhelmingly, and you'd be taking care of their trauma issues and then find out that they have COVID, and now we understand why we couldn't get them off the ventilators when we used to be able to. And now it's more of a risk for us, having to go home and not realize. It was very scary. I mean, it became so busy because the patients were coming in like bombarding us and they were pulling to the COVID unit. We would go to the COVID unit. It was so, I got in my car after work every night and cried. It was just, and I wasn't really sure why at first. I was just like, why am I so, like I would feel, I guess, because I wasn't sure if I had it, because symptoms weren't showing up for 14 days. I wasn't sure if it was because of the patients, because they were so sick and you were like, is it because you're seeing so many patients die? Just wasn't sure, but I would get in my car, take off my mask and just cry.
That's horrible. So now both of you can answer this question. What month did you see that transition where the numbers were going up and up and up and more people were coming into the ER and more people were being admitted to the trauma unit? What month was that?
as an emergency room nurse. We take care of them when they first come through the door. Seeing people come in who were basically walked in,
Right.
then within an hour ended up so sick that they could eventually die within a number of days. I think that was the most startling thing. And I think that happened in the end of March, beginning of April. At the beginning of March, it was people were coming in basically with like flu-like symptoms.
Mm-hmm.
And then they were rapidly getting sick, for lack of a better word. I mean, I would say, but at the beginning of April, because people were afraid to come to the hospital, they were coming in sicker. And I think that's what we were dealing with in March, in April. I mean, they decompensated so fast. You could have somebody who came in walking and talking, and then in a matter of an hour, they were completely so very sick that they needed to be put on a ventilator.
We were sideswiped. It didn't like gradually come. It just said, bam, it was just here. It wasn't like they, it just gradually got worse. It just was here. And then like, we didn't know what was going on. We didn't know how to deal with these problems. Like, I mean, it was just, first we weren't wearing masks, then we're wearing masks. Then they didn't have any PEEs. I mean, PPEs or, it just hit us.
I think for me, one of the startling things was at the very beginning of this pandemic, at the beginning of March, or in the middle of March, I went to Key West for my birthday. And I came back in and I flew back in through Miami. Now, if anybody's ever flown through Miami airport, it's always chaos. It's always hundreds and hundreds and hundreds of people milling around or just going about getting on the airplane. That March 21st, Miami airport was completely empty. When I got back to Temple on the 23rd, Temple was completely empty. My emergency department was completely empty. By April 1st, 6-7 days later, we were completely overwhelmed. Mm-hmm. So within 6 days, we went from having basically 10, 15 patients in our emergency department to where we are seeing 200 and 300 patients a day. Yeah. And it was just that fast. It was like someone flicked the light switch off or on.
Yep.
That is so horrible. Now, so the cases are rising, and now the visitation policy has to change. Mm-hmm. Jacqueline, tell me about that shooting victim that is now on the trauma floor. And what about that youth shooting victim that is now on the trauma floor, and they can't have any visitors? They can't have their mother. They can't have their father there. That actually impacts their recovery process, doesn't it?
Oh, absolutely. Absolutely. They would come in, they're like 18 years old. And like when they first came in, like at first we had it where if they were first admitted, their mom and dad could come up, at least see them for 15 minutes. And then that was it. Then that was done. They couldn't come back. I think we had slacked up. We kind of started letting too many visitors in at one time. People would come in, they wouldn't want to wear their mask. I mean, so then they cut them off completely because our numbers kept rising, and then we were starting to get it in the community, with the nurses. So they just cut them off completely. So I just can't even imagine being somewhere, being so sick. These patients are on ventilators. They're just getting many procedures done, and there's nobody there with them, and then the unit is so busy, it's hard for you to just sit. Like you want to be able, like an 18-year-old is scared,
Yeah.
You want to be able to, and it's just it's so busy that you really can't sit and be social and be, like there's psychologists, there's psychiatrists, their doctor, their nurse, it was just overwhelming. And then like I tried to do FaceTime with them. And then, like I said, it's just busy.
Yeah,
We just forget.
it's
And I
hard.
think it affects them. They're
Right.
a
Right,
lot of
right,
depressed. I mean,
right.
I
And
can't even imagine. Now, Oscar, was it the same policy in the ER?
yes, in the ER, it was slightly different because of the influx of people. Usually when there is a shooting victim, as we're talking about now, there might be 10, 15, 20 people
right.
who show up at the same time,
Mm-hmm.
and none of them were able to get in. So now you have the added uh,
Mm-hmm.
anxiety of the staff who have 20 people, mother, father, immediate family, who cannot come into the ER,
Right.
along with taking care of the victim. So that alone added stress to the staff and to the victim. If the victim was conscious, he or she would say, "Why can't I see my mother? Why
Right.
can I see? Why can't I see that?" And we would have to. So then, I've always said that there's as a nurse, you have two patients. One
Yep.
that is
Absolutely.
one that is horizontal and one
Yep.
that is vertical. The horizontal is the one that's in the bed. We can use technology. We can actually help them in a minute to minute thing. The other patient that we have is the vertical patient. That's the mother, the father, and the immediate family. They're our patients too, and
Absolutely.
they need to be nursed
Yep.
too. So as a nurse, it's very difficult at that point to tell that patient that is upright and standing that they can't be administered to, that they can't be helped to get through this process too. And I think that's what adds the stress. So as an emergency room nurse, as seeing that person in distress, in literally moral distress, and not being able to reach them or not be able to give them the same type of help that I would normally do is also it's painful. It's basically to say at least it's painful.
And I understand that. And it really touches my heart to hear you say that, because we have a very great collaboration with Temple University Hospital under Scott Charles and Dr. Goldberg, where there's 3 community-based agencies that would come into the hospital and we would see the victims real time. So we're seeing those shooting victims, the domestic violence victims, the assault victims, and actually the family members of those who have just lost a loved one.
Mm-hmm.
All of that came to a halt in March
Yep.
because of the severity of the COVID, and we didn't know what it was. So for me, the victim advocacy work that I provide is not a job. It's my passion and I love it. So for
Mhm.
me not to be able to see those victims, it hurt. And for
Yeah.
them not to lay eyes on me, that actually hurts me, to let them know that I'm here. I'm not a one and done agency, and I'll be in your life for as long as you will allow me to, and I'll help you through this trying process. So I do understand that, and that's so important what you said. Now, Jacqueline and Oscar, at the moment you realized that this coronavirus was this severe, did you ever think about taking a leave of absence from
Mhm.
work? See, unlike me, I could work from home to be able to ensure that I was safe and my family was safe, but you weren't giving that option. And how did your home life change because you're coming home to family members?
I mean, I think this is the least amount of time I've called out. I mean, like, because I feel like when you're there, like you want to so bad, you just want to be out because you're so exhausted. I'm telling you, I need like 3 days off to really get myself back together. I never needed that much time to get myself back together to go back to work. But I haven't been calling out because I know that these people need me. I mean, it sounds kind of, I guess, on the corny side, but like to leave my staff short, it's already so hard to take care of these patients. And then when they're short, it's not, they can't find nurses anymore. Used to be able to find nurses, but you can't find any nurses anymore because it's so bad. I mean, I probably really need a mental takeoff. I need to probably leave for a week, but as of right now, I haven't taken off any days.
How did it affect your home life?
Well, for me, it's all about me because I'm only by myself. My daughter is in Chicago, so it's been very trying. You go home to yourself, and people will call and say, "Oh, we're gonna go to this place. It's only gonna be 10 of us." I'm like, I can't do that. For one, I that I'm around it all the time. So to me, if I give it to you, I can't live with myself thinking that I gave you something, And also, I don't want to. If I'm gonna catch it, I'm not gonna catch it out on the street. That's just not where I'm gonna go. I'm not going out to the bar. I ain't going anywhere else to catch it.
I think that's exactly the tenor and that I took too, was that I considered myself a vector. And I always considered myself, no matter what situation I was in, I was going to be patient zero for that super spreading event, because we were around it so much. And going back to Jackie's first point, and to answer your question, as we lived through this, it became a silent killer. You were fine one day, you were walking around, you were talking,
right. Yep.
you were interacting with your family. You literally walked into the ER because you had a cough for a week, or you had a cough for a day. And, displaying what everybody knows, what considered flu-like symptoms. Mm-hmm. And so when I would leave out of the hospital and go home, I lived with my son, and my son was considered an essential worker too. So he had to leave out of the house every day. So we literally stayed in separate rooms, and we would FaceTime each other from separate rooms. Or we would sit on the couch, and I would sit in the kitchen. He would sit on the couch, and we watch TV together. Things like I had dinner with my parents every Sunday night, like clockwork, or not Sunday night, Monday night, and that had to stop. I mean, on a dime, it just didn't dwindle off. It just stopped, and I think. Excuse me, that's what the reality was for me, that life changed so fast that as the emergency room nurse, I look at being able to take care of anything that walks through the door, not knowing what's walking through that door, not knowing whether it's going to be something like anthrax or something like a subway accident. Have no idea. But I think this was the first time that I took care of somebody who might kill me.
Right.
And there was no cure. That was sobering. It was when you walk into work, you expect to walk out. As a nurse, I'm not saying that there's other professions, notably, firefighters and police officers, there's always that question in their mind. As a nurse in the emergency room, I expected to take care of the sickest of the sick, of the most ill patients on this planet, and was prepared to do that. But I did not think or expect that they would in turn infect me, not only hurt me, but hurt my mother, my father, my brother, sister. Yep. And that was like, I've been a nurse long enough that I can remember the beginning of the AIDS epidemic, where we literally did not know what AIDS was. And people were coming in very sick, and that was scary too. But we were afraid for them. Mm-hmm. Not afraid for ourselves.
Right.
We knew that we could take adequate precautions to protect ourselves, but we were afraid for them. And I can remember very distinctly saying, "Oh my goodness, oh my God," praying with patients who had AIDS, knowing that there was no cure back then.
Right.
And then now, or in March and April, I'm praying with my staff so they could get through the day.
Yep.
You know, so that was for me the biggest thing was that not knowing whether or not I was going to go home, be safe around my family and myself.
That's just something. And Jacqueline, you made the same thing earlier. I don't know if this is corny. It's not corny. It's beautiful. Both of you are beautiful people, and we needed you on the front line, which is amazing. So Jacqueline and Oscar, please share a touching story with us, no name, on how you helped a shooting or domestic violence victim, assault victim during the COVID-19 pandemic. Jacqueline, for you, and on the trauma floor, and Oscar, for you on the ER side. Please share a touching story of how you helped a crime victim.
Looking at Temple Hospital as a general overview, for years, we have led the Southeast in the most penetrating wounds. It's New Jersey, Delaware, and Southeastern Pennsylvania. Most penetrating wounds, stabbings to shootings. And I think that when I look back over the last 9 months or a year, one of the most touching moments, if you want to call it that, was when I had to talk to a mother who had lost her son. Mm-hmm. And because of our visitation policies, we would let families in the emergency room, knowing that this could possibly be the last time they saw their loved one. So we would let them in. And even all through the pandemic, we would let them in for a brief period of time, knowing that once they left our department, they were no longer going to be able to visit their son, daughter, father, mother. So I think for me, the most touching thing was that I'm used to meeting with my patients and not having any barriers. And there was just one time I remember vividly where I went to the family waiting room and to deliver news. And I've always been used to sitting down, kneeling down next to someone who's had some very bad news and being able to touch, being able to hold their hand. And here I was, because I was afraid, not being able to do that. And I have full PPE on. I've got 2 masks, gloves, gown, and everything. But because of disconnect that COVID caused, I wasn't able to do that. And I wasn't able to have that kind of contact. And it felt very sterile. And I think generally overall, that's what hurts. Not being able to look at or touch or hold somebody. Knowing that at that particular point, they need a hug. They need that personal contact. Especially someone who I think who's like, when you lose a son or a daughter, you feel like your whole world just crashes around you. And Melanie, I know you know this from being a victim's advocate. Not only does the world crash around you, it changes. And sometimes you need that connection to know that the world is still spinning.
Yeah.
During this time period, sometimes we cannot offer that connection. Everybody has that one thing in their life that they hold on to. And then sometimes it's a son or a daughter, and now they're gone.
Yeah.
And I think that during this experience, I'm talking globally now, that's changed because they can't have those last final words. They can't have that last contact.
Right.
And the contact they have is through me. And I can't even offer the same kind of contact because I'm in full PPE. And I, because of this, cannot offer the same type of services that I would offer before.
Yeah, which is so horrible. How about you, Jackie? Is there a story that stands out for you?
Well, there's many stories, but I do remember a patient he was an older gentleman. He had an extensive family, big family, and they always were very argumentative on the phone. They always wanted to come in. I mean, you would tell them everything and anything. You can get the doctor to talk to them, but they just were very angry because they couldn't come in, which is understandable. And then they had a family meeting, and the family came in. And they let 4 of them come in. Of course, they wanted more than that, but that's all that they would allow to come in. And while at the bedside, the patient coded, and we did CPR and the whole 9 yards on the patient. And it was, I don't know whether it was a kind of a gift. I mean, I don't know, to have the family there when the patient coded, because, I mean, the guy he had COVID. He wasn't going to make it. It went to multi-organ failure. And people don't understand what do everything means. Do everything is a lot of stuff.
Yeah.
And sometimes when you see it, then you understand what do everything means. And then, I mean, like, even after they called it, because we worked on him for like a half an hour, which is a good amount of time for him not regaining a rhythm at all. And then they called it, and the son was like, please keep going. And he's like screaming at the top of his lungs. The family's crying. We did continue for a little bit longer. And then they said, he's not regaining his heart rate. And they sat with him for about a half an hour afterwards. And then they left. But then they called back and they said, yo, I just thank you for everything that you did. I'm so glad I was there to be with him when it happened. I mean, it blew my mind because I didn't really think, I thought they were going to be angry and mad at the temple, but they were actually saying that we did everything that we could possibly do to help their grandfather and their father. So I was surprised by that. But when she called me, I felt very, I don't know, it was a good feeling because, I mean, she just was very thankful, They sent a call.
And thank you means a lot.
Oh,
so
absolutely.
Working in the nonprofit field, it's not about the money. You don't get paid a lot of money. But when that family member, when that mother, that father says thank you, that's payment enough for me.
Oh,
so
absolutely.
For Oscar and Jacqueline, I want to say thank you for all of your hard work that you have done over these last 11 months. Your hard work has not gone unnoticed. Thank you so much. My hat goes off to you. Thank you for joining me today. And I ask that you please continue to try to be safe. Thank you. The COVID-19 pandemic has required hospitals around the world to make difficult decisions on how to balance minimizing the transmission of the virus and continuing to provide compassionate and high-quality patient care. My hat goes off to all of the healthcare providers. Northwest Victim Services is extremely grateful to all of the staff at Temple University Hospital and our collaboration with Dr. Goldberg and Scott Shaw. I strongly follow Dr. Martin Luther King's philosophy. Whatever your life work is, do it well. A man should do his job well, that the living, the dead, and an unborn could not do it no better. Dr. King's philosophy was also life's most persistent and urgent question is, what are you doing for others? Continuing the work of Dr. Martin Luther King is not optional for me. It is my lifestyle. Peace and blessing.